Madam President.
The senator from Missouri.
Madam President, last night at the State of the Union message, the President looked at the Congress again and said, you need to be for my plan unless you've got another plan, and suggested once again that we'd never had other plans. I don't know in a handful of minutes I can do justice to the other plans that were out there, but I can tell you that there were other alternatives. They were filed in legislation. They were debated in 2009. And clearly, today's experiences, like has just been shared from a family from Wyoming, would be different experiences if we'd have looked at those other plans. Let me just very quickly, in responding to the President, what are your ideas? Remind him again of what the ideas were that were out there, that were proposed by people who thought we had the best healthcare system in the world, but thought it could be improved. Thought there were people who did not have the access they needed, rules that could be changed to make a difference. Here's what some of them are. One, to allow small business health plans. You know, most people get their insurance at work and they like what they have. 85% of the people that had insurance last year got insurance at work, and well over 90% of them thought what they had at work was really good and met their needs. We have for years talked about ways to try to expand that so people, whether their association is the Farm Bureau or some other group that they're associated with, where they can, in small business or associated health plans, get their health care that way, so they too become members of a bigger group that competes for health care insurance as part of that group. Expanded coverage for young adults. The President said last night that he said 3 million of the people have been added of he thought maybe 12 million. I haven't seen that figure yet. A few days ago, Senator Reid said it was 9 million, and a third of the people that had been added by just saying, let people stay on their parents' health care a little bit longer. That was the most uninsured group. The only person that filed that legislation in the House as the principal sponsor was me, to let people stay on their insurance. Now, we said 25, not 26. So I suppose the President added that 1 year to it, or whoever wrote the Affordable Health Care Act. But if that's right, I got the bill out the other day here on the floor. It was 3 pages and 4 lines. If 3 pages have solved 25 to 33% of the problem, I guess maybe our side should have come up with 12 pages of legislation and just solved the whole problem. This was not something that took 2,600 pages that nobody really understood. Madam President, if we had that debate today, it would be a much better debate, because people have begun to understand just how dangerous it is to deal with the health care of individuals and families. Medical liability reform makes a big difference in how cost of insurance is impacted and how health care is done. Increased your insurance flexibility. Let people buy insurance across state lines. This is something that was out there as a significant idea that didn't minimize the choices people have. It maximized the places people could look to find out what their family needed. Pre-existing conditions, we had a system that was dealing with that pretty effectively if you could get into it, the state high-risk pools. We talked about ways to expand those. Now, why would that be better than where we are now? If you're an insurance company, if you're a government, if some way you're making that high-risk pool work better, you know you're dealing with a group of individuals that had a pre-existing condition. You don't have to try to structure everybody else's cost so that they pay a lot more just in case people with a pre-existing condition become an unreasonable part of your insurance group that you're trying to provide for. These programs have been closed as of December 31 in most states, and in every case that we've been contacted on, people that had pre-existing conditions were in a high-risk pool are paying more for insurance with less coverage, and in many cases can't get the doctor. And these are people who had a pre-existing condition, so who their doctor was mattered to them. In many cases, they no longer can have that doctor. Clearly, I don't have time today to respond fully to the President, but whether it was high-risk pools that work better, wellness programs, preventing insurance companies being able to cancel policies, that didn't require millions of taxpayer dollars. It just required a rule that said you can't cancel a policy because somebody gets sick. Same as limits on coverage. Encourage health savings accounts. The Affordable Care Act eliminates one of the real tools that was working for families. More transparency. How do healthcare providers do, and how much do they charge to do it? What are their results and what are their costs? And income tax treatment so that everybody who buys insurance buys that with dollars that are treated the same way. If the biggest company in America can buy an insurance policy and have it non-taxed, have it tax deductible, so should the individual that has to get insurance on their own. Madam President, there are a lot of alternatives out there. There have been. They would work better, not nearly as complicated, not nearly as expensive. The president needs to at least understand that there are plenty of competing ideas. His ideas on this are not the only ideas that would make this system work better, and I yield back.